can say where the road goes, where the day flows, only time. And who can say if your love grows as your heart shows?
As the novel coronavirus continues to spread across countries of the world, it has become evident that it will take more than just issuing stay-home orders and other protocols to win the fight against the deadly virus. As nations grapple with the effect of COVID-19 and health organizations working tirelessly to find a vaccine, world bodies continue to put in place guidelines to protect especially vulnerable groups such as the aged, children, and prisoners from contracting the virus. At the best of times, prisoners have to live in overcrowded conditions, a situation which can only be compounded by the COVID-19 pandemic. The World Health Organization issued guidance on preventing the outbreak of the virus in prisons. Ghana, like other countries, responded to the call by granting amnesty to about 1,602 prisoners. The Ghana Prison Service also rose to the occasion by putting essential protocols in place to prevent the outbreak of the pandemic in prisons, which might be difficult to control in an already 52% overcrowding capacity rate for prisons in the nation.
The Prisons Administration has been very proactive because we are aware that should we record cases in our prisons, because of the congestion in our prisons, it will be very, very difficult to control. The rate of transmission will be very high and uncontrollable. And so when it comes to the issue of social distancing in our prisons, in most of our prisons, it is simply practically impossible. And therefore, the focus has been on prevention.
The Ghana Prison Service, together with the Ministry of the Interior and human rights organizations POS Foundation, also organized a series of training workshops for both inmates and prison officials to bring them up to speed on preventive measures and how to deal with COVID situations should there be an outbreak at any of the facilities.
When the disease was in China, Wuhan, WHO had not renamed the virus COVID-19. And that was when we anticipated that it can come to the prison. So that is when we did the health alert. The first on the list we look at is prevention. The second is alternate ways of incarceration. The third aspect is disease surveillance. Then the fourth aspect is case management and contingency plans. Then the fifth one is the practical aspect of the contact tracing and the case management day-to-day when you have outbreaks. These are the structure for WHO, that is World Health Organization network for prisons. Then the other aspect of disease surveillance when it comes to COVID-19 is what we have done so far, is emergency preparedness and contingency plans. If in this prison we don't know if someone is to have symptoms of COVID-19 here, and we don't know where to isolate the person, it becomes a problem. That is why there was a circular also initially. After the health alert, there was a circular on a guideline that came on COVID-19. And that circular didn't touch only on the emergency preparedness for the inmates. It also came with the change in the dynamism of the operation of the prison. That is why officers, I'm sure officers that live very far from the prison environment were made to take their compulsory leave.
The service also instituted a joint health operation risk communication task force to educate and inform inmates about preventive, security and safety protocols on COVID-19 in order to reduce tension posed by the virus among prisoners.
That is why the first guideline, as it was stated, came to say that make sure that you have observation centers. The observation center was to receive all new admissions so that at least the people who are already there will not feel that their basic fundamental human rights are threatened. Because if you are bringing new inmates, the people already there who knows that already the police cells are infected, and you are bringing inmates from there to them, they will feel that you want to kill them, because invariably these people will be having the COVID. So what should we do? We should have an observation center so that we can keep people there and observe them, monitor them, and make sure they don't have any symptoms. Risk communication. That is the single most important thing you can do in the prison. Why? We assume the prison nobody have phone there, so they cannot access any internet. So that means they are oblivious of every information. So where they get their information from is from you, the officers. So if you are an officer and you don't know and you spread rumors, then you are creating fear and panic. So that is why it is so important for the health and the operation team to have a strategy to communicate the right information to the inmates. If that is not done, you'll be there and they'll be thinking the disease is with them. By the time you realize, they are planning escape. The last aspect of the whole thing is stigma reduction. Because we can never say that nobody will have COVID in prisons. But if the COVID comes, definitely most of us will survive. When we survive, how are we going to come back to the system? An inmate is tested positive. He goes to quarantine center, he's now fine. We bring him back. How do you think the rest will treat him? So this is the time to start the stigma reduction. We have to let them understand that it is here to stay with us. This is something we have to deal with. If it comes, people will get cured. When they get cured, they are fine. They are your brother. You can eat with them. You can smile with them. You can sit with them. But just make sure you maintain the standard preventive measures.
The vigilance of prison authorities and strategies put in place by the service has ensured that no case of the virus has been recorded in any of the prisons among 7 inmates. Although the virus has enforced the hygiene culture in all prison facilities, it has come at a cost to the Ghana Prison Service.
The impact has been very, very huge. We get donations from visitors and well-meaning Ghanaians and corporate bodies. But with this, some of these interventions have also seen a remarkable reduction. And so our farming activities and the donations are the things that we have been using to supplement what government gives us. And that has been hugely impacted. And therefore, the challenge is huge going forward.
The POS Foundation, a non-governmental human rights organization, facilitators of the Justice for All program, during a training workshop for selected prison staff and inmates on COVID-19, also donated several items to the following prisons. At the Nsawam Medium Security Prison, the team presented items including hand-washing machines, alcohol-based hand sanitizers, food, toiletries, face masks, Veronica buckets, and yards of cloths for the sewing of face masks by inmates.
And this situation calls for a critical and a drastic approach. That is why we are calling on the President to activate Article 72 and grant pardon to more of the inmates here, particularly those who have been sentenced here for minor offenses, misdemeanors, petty offenses. We need to also show mercy at this time. Another area that we are calling on the President, the Prisons Council, and the prisons authorities to consider is to also factor drug users who have been convicted here onto the amnesty criteria. When we say drug users, these are people who are non-violent drug users. That is what we want to stress on. If you look at the original capacity or authorized capacity of the swarm, as we have been told by the prisons authorities, is around 850. And currently, they are hovering around 3,500. So if COVID should get inside the prisons, I bet you it will just run like bushfire.
Similar items and packs of vitamin C were presented at the Kumasi Central Prisons.
The donation came with a training program for both officers and inmates alike, and the strict adherence. Inside the prisons, all the protocols are observed. That is why we still haven't recorded any case.
The plight of a prisoner in Ghana is the same as the plight of the prison officer. If there are diseases, some of the prison officers also contract them. In fact, they are risking their lives so much. And we are calling on government to support them with incentives or give them incentives, and particularly activate a disease allowance for prison officers, because the work is so risky that whatever happens to the prisoner inside is the same thing that happens to the prison officer, and sometimes, unfortunately, they carry it home and affect their entire families.
Team POS was also at the Sunyani prisons.
To look at these huge donations and the amount also presented, for us, we are happy. The items and the money has come at appropriate time, and we hope that it's going to augment the little donation that we've had the previous times. So for us, this is going to help us to maintain the protocol that has been set.
The Executive Director of POS Foundation, Jonathan Oseiwusu, at the Tamale Central Prison, commended authorities at the Ghana Prison Service for the prompt steps taken to avert a possible COVID outbreak in any of the facilities.
The non-custodial sentencing regime. There is what we call parole, probation, that exists in our laws that are not in active force because of lack of LI and CI. It is important to get the prison service, Ministry of Interior and Attorney General Ministry and Ministry of Justice to quickly push for the LI and CI so that those who have served their sentence and have good character or conduct can be given some parole and go home, be monitored, and then congestion will still not become a big issue in our prisons. Then the critical one among the non-custodial sentencing regime is what we call the community service bill. Now the president mentioned that if you don't put on face masks, it's an offense. When they are arrested and they are fined and they are unable to pay, are they going to bring them to prison to add on to the congestion already existing in prison? That is why there is an urgent need to get the community service bill pushed to cabinet and to parliament so that we can go through the process quick.
The team was also at the Navrongo prison.
1 city, 80 persons. And now this thing has been aggravated by the fact that we don't receive visit. If the money, sometimes they receive visits so that it will come to supplement their food from the people that brings things. But now because of COVID, they are not even allowed to receive visitors. So you can well imagine how they are suffering. And as you have said, their immune system, how will they boost their immune system if 1 city, 80 persons? What food are you going to cook for them if this money? And prisons is not for one man. Anybody can find himself there.
We are ending this donation, which started from the Insawan medium security prisons all the way to Kumasi, Sunyani, Tamale, and Navrongo, and finally ending here. It will go a long way to help the Ghana Prison Service as it takes care of its inmates and officers. Although the president has granted amnesty to some 808 deserving prisoners, and consequently on 1st May granting amnesty to 794 prisoners, we believe that more can be done, especially for non-violent drug users. We believe that drug use or drug abuse is a public health problem, and as such it should be treated in that regard.
We are grateful to POS Foundation for this very donation. It has come timely, looking at the current situation of this coronavirus pandemic. When you look at the female prison, we are lucky. Our official capacity is supposed to be 200, but as we speak, the lockup this morning, our population this morning is 72. So with our end here, we are not facing the overcrowding. So far, we have had all those that we receive, fresh admissions. We isolate them, we observe them for the 28 period. Those that we have recently, we did that and none of them showed any signs. So I can say, by the grace of God, and with the strict adherence of the protocols, we have not yet recorded.
The team, before it embarked on the training and donation exercise, was at the Ghana Prisons headquarters for a discussion on non-custodial sentencing regime, which includes community service, probation and parole.
The POS Foundation would like to express our profound gratitude to the GIZ and German Corporation, as well as Open Society Foundation and OSIWA for their swift response in providing funding and support for the COVID-19 Prisons Response Project undertaken by the POS Foundation across prisons in the country. We would again like to thank the Ghana Prison Service for the dynamism brought to bear and the display of professionalism that has brought about the successes in our prisons. We would like to call on developing partners and donors to continue their support for actors within the criminal justice sector to sustain the fight against COVID-19 in our criminal justice sector, particularly our prisons, towards the promotion of justice and human rights.